Hello, everybody. I'm going to start talking about a new opportunity in Santa Cruz and Monterey counties. So if you want to take a seat or not, you can stay standing. So Janice of Santa Cruz County applied and received federal funding from the feds, that's redundant, but for a hub and spoke model for coordinated and integrated medication-assisted treatment for our communities. And I have with me Nancy Krause, but if you, whether you as an individual or your organization might be interested in becoming a spoke for this hub and spoke model, please talk to Nancy or myself. Probably Nancy is a better shot, or a better person, sorry. So Janice of Santa Cruz County is the hub in this model, so they are the center. They provide methadone and buprenorphine, and the spokes are all the folks on the outside, and I have a larger representation of this slide in a moment. So basically, to address the opioid epidemic and the rising deaths, and here's the picture that's kind of graphic for this situation, this is what the federal government chose. The hub and spoke model is actually originally from Vermont, and the feds evaluated this model and thought it was the most effective. They looked at lots of different models from around the country, and they chose the hub and spoke because they felt it was the most successful at reducing deaths. So if you're a healthcare provider or a public health department or any number of these different entities on the picture, please, and you're interested, please approach Nancy. So very basically, the hubs will provide care to the clinically complex patients. And Janice was mentioned already this morning, they are providing care to clinically complex patients. And the hubs will provide support for the spokes. And it's my hope that that conversation about difficult patients that we share will now be supported with this hub and spoke model. And Janice will now have funds to coordinate care for our complex patients and technical assistance and bidirectional referrals. It's all kind of exciting. So if you're a spoke, you need to have at least one prescriber and an M80 team. And I know that there's some flexibility in this spoke concept because I know that there's some entities that may not have all of that in place initially. And the spokes provide ongoing care for patients with milder addiction. And patients can move back and forth between the hub and the spoke. All the spokes have to be Medi-Cal providers, so that is, I think, non-negotiable. So basically, there are a lot of benefits. I do want to move into our content, but the M80 Advisory Group, where there's the sign up on your desk, that is actually going to be, or already is, one of the spokes. So we welcome you, and I'll say it again, no matter what your role, consider joining us. We have an online Google group listserv where we ask questions of each other. And Dr. Santiago already did that. We appreciate the responses he got and the support for the question. And there already are some spokes in Monterey, but plans for San Benito and Monterey counties in terms of increasing the number of spokes. Folks are here from the Natividad residency. They're planning on an addiction medicine rotation and increased resident training, which is obviously critical for success, and another opioid treatment program in Monterey County. So Mark Stanford's email is up there. Nancy Krause has a similar, I'll write your email up on the board. So please find Nancy if you're interested. Great, thanks. Anything you want to add?
Not so much. I mean, this is going to be a really great opportunity for referrals from primary care providers, from actually just the public in general. We're going to have a 211 line that will connect directly or indirectly to our program manager for people on the outside who are suffering from opioid use disorder. And they will be referred either to our NTP, the opioid treatment program, methadone, or most likely to a spoke, depending on what that spoke's availability has, for what their panel size looks like, what kind of patients that they're looking to get onto their panel. We're also going to provide counseling to those agencies that don't have counseling on site. That's one of the issues around becoming a buprenorphine provider, is lots of providers aren't comfortable with the population, meaning that they don't know how to deal with the behavioral health treatment portion. And through the hub and spoke, we're going to have counselors that'll come onto your site and do the counseling for you. So that's going to be a great addition.
Wonderful. Thanks so much.